I imagine that this wasn't something in medical school that you thought you'd be spending so much time thinking about and researching healthcare disparities. But I'm wondering how it changed you as a physician and what you've learned by dealing with patients who have some of these challenges to help them get healthy and live better lives.
What I've been excited about is both researching and putting into practice some of the tools that people have studied to be more aware. So for instance, we talked about interpreters, but what about hiring more staff that look like our patients? What about hiring more people who can help these patients throughout all of their touches to the healthcare system? What about using health promotion tools that are culturally sensitive? If some particular population eats a certain way, has a certain kind of pattern to their diet, because we know that diet has so much to do with chronic conditions, just telling them, oh, you need to eat a Mediterranean diet isn't going to cut it, right? So what if they don't have access to the food that's in a Mediterranean diet because they live in areas where there's not a lot of fresh groceries? So what can we do to reduce the harm? Harm reduction is a great term here. And so coming to a place where you can at least respect their culture, listen to what they have to say, and not just disengage and get frustrated when they don't want to do what you say, is hard work, but it's very rewarding, because most of the time, even if you agree to disagree, if you don't come to that perfect decision, the fact that you've made that effort, most patients really are grateful for, and they want to come back. And so by having access to a doctor continuously over years, you get to know each other well, and hopefully you can make the kinds of changes that they need to improve their chronic conditions.
So where are we headed in the future to try and bridge the gap between healthcare disparities that exist today?
Well, I think first and foremost, we have to keep these people insured. We have to continue to advertise that Obamacare is still alive and kicking, and enroll people as much as possible so they have an insurance plan. Without an insurance plan, people are not going to engage at all. So that's one thing. Two, we need to create an environment of cultural competence throughout. It's happening in institutions everywhere. It's happening in education. We need to understand how to meet people where they're coming from, and we need to understand our own biases. I mean, there's systematic racism. We know this already. So what can we do throughout the United States, but even in healthcare? Is there something about the way we view someone who is Black or Hispanic because of our lack of experience or ignorance of their values and preferences? Do we give up more quickly? Mm-hmm. Do we say, okay, you don't want this treatment, fine. They all need somewhere to go. If they go to a place that they think doesn't listen to them, doesn't respect them, doesn't empathize with them, they're gonna go elsewhere if they can. And if they can't go elsewhere, but they're not getting good care, that's terrible, right? Most of us go into medicine because we want to help people, and we want to have that gratitude. We know the system is a bear. We know that we have to deal with a lot of bureaucracy, but on a micro level, what can we do to reduce some of those headaches for patients?